This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2025. The prevalence of mental health disorders among adolescents and young adults in the United States is steadily increasing. In orthopedic care, conditions such as depression and psychological distress have been shown to negatively affect treatment outcomes, especially following hip surgery. To better understand this connection, researchers conducted a study to identify risk factors associated with depression symptoms and psychological distress, and to explore how poor mental health is associated with patient-reported pain and hip dysfunction. The study included patients who were 10 to 24 years of age, had hip pain, and completed questionnaires related to patient health, mental health screening, and the International Hip Outcome Tool 12, or IHOT. Through logistic regression models and advanced statistical tools, the investigators identified risk factors for psychological distress and depression symptoms, and further evaluated their impact on hip dysfunction. Their analysis revealed that 10.6% of patients reported moderate or greater depression symptoms, and 26.9% of patients experienced severe psychological distress. Young adults who were 20 to 24 years of age had higher odds of moderate or greater depression symptoms compared with adolescents. Additionally, female patients, patients who were overweight, and patients who had undergone a prior hip surgery were at increased risk for severe psychological distress. Importantly, both elevated depression symptoms and higher levels of psychological distress were strongly associated with lower IHOT scores, indicating worse patient-reported hip pain and dysfunction. Overall, this study highlights the importance of incorporating mental health and screening into orthopedic care for adolescents and young adults with hip disorders to better identify and address psychological distress and its impact on patient outcomes.